and of course it's a balance, and a lot of the concern is where will these businesses be a few months from now? And you're not an economist, and you're not the business. Well, I guess you are kind of a business owner too, but in the sense of like bars and restaurants and everything else, there will be some serious consequences for the economy in New York City as well as the rest of the country. When you say not rushing reopening and also going into the fall, how concerned are you about the spread of coronavirus? Do you have any predictions?
Well, look, we've had so far about 5 million cases in this country of corona. We've had 160,000 deaths, tragically. But what we're seeing is that although there's an increase in the spread of corona, there is a decrease in the death rate, which is a little bit of a silver lining. We're also seeing that there is, in the demographics that are getting COVID mostly now, are those ages 18 to 29 and also 50 to 64, and especially that age range of 18 to 29. Their mortality rate is just about 1% or under that. So I think that's good. Things that I worry about in the fall is as we get into maybe coming out with the COVID-19 vaccine by the end of the year and next year, I want to make sure that enough people get the vaccine. And then as we head into flu season as well, we're having a whole other thing to contend with, which is seasonal flu. So making sure that everybody gets their seasonal flu vaccine, and also making sure that we're monitoring for that as well. And people getting just our routine health screenings that they've been putting off for so long. We've already seen that there haven't been as many routine colonoscopies and mammograms, and we need to be sure that people start getting those too.
Yeah, a lot of people have been pushing off things that they need done medically because, number one, they don't want to go to a hospital because they're afraid of picking up coronavirus there. Number two, it's impossible to get an appointment, and some places aren't even taking appointments right now. You brought up the vaccine, which I thought this was interesting. According to a Gallup poll, it says that 35% of Americans would not get the vaccine even when it is available. I'm one of those people. They didn't call me for the survey, but I'm also that person who doesn't get flu shots. And I know that we've had a debate about flu shots before. You get your flu shot and you always tell me to do it.
Yes.
I refuse to do it, and I'm not going to get this vaccine for COVID. So what would you say to those people?
Here's the thing. What I would say is that vaccines are safe, right? Vaccines which are approved to use in this country are completely safe. And this is a debate that we always have. I mean, we have a tough enough time getting people to get their flu vaccine, including you, Stephanie, so it's going to be hard to get people to convince them to get the COVID-19 vaccine. That study that you're referring to assumed that the vaccine was safe, that it was available today, and that it was free. And still 35% of people said they won't get it. And it's also a struggle to get children to get their routine vaccination. So I can't stress this enough that vaccines are safe in America, and that currently with Moderna, this COVID-19 vaccine is in third phase trial. So by the time it comes out, by the time it gets the green light, it's going to be completely safe. And they're hoping to have 300 million doses by later this year or early next year. But it will be a struggle to get people to take it, because a lot of people just don't like getting vaccines, whether it's a vaccine for shingles or vaccine for pneumonia or vaccine for chicken pox. It's a continued battle that me and other doctors fight almost every day.
I bet. Well, Dr. Vitale, we're going to have to leave it here. Thank you so much for your insight, and stay safe out there in New York City.
Want to see more videos like this? Click on the link below and subscribe to One America News on YouTube, and call your cable provider and kindly demand that One America News is added to your lineup. Call and subscribe today.